And let's do our HESI review. This is our first Cahoots that we have, and it is brand new. Nobody's done it. It's mine. Doesn't cover everything yet, but it does have a lot of great information. So congratulations, Amy. Good job. And I know you're always nervous, but look at that. You took your time, and I apologize for all of the confusion in the beginning. It was great. I had to go back and change a bunch of stuff. I had to do a lot of things, but we got it done. It's all that matters.
Do
you have any failing?
2. And not horrible.
Jesus Christ.
Oh, Whitney. Really, are you worried?
I am.
No, don't. I'll just say don't be worried.
Okay, cool. I can sleep tonight.
You know, my heartstrings are big. It's hard for me to not say something, but I can't give grades. Anyway, here we go. All right. And I had a great birthday. So here we go. HESI review Cahoots. A multi. Nursing care of a child with meningococcal meningitis. Well, what do you have to worry about? A child has a bacterial infection in the brain on the meninges. What is your thing that you need to do or be concerned about, right? And this is the way I want you to rip through questions. Think about what they're asking for and what do you know. So this is one that will be on droplet precautions until 24 hours after antibiotics. Usually most bacterial infections, 24 hours on antibiotics, and then you could take the precautions off. The spinal tap is going to tell you, is it viral or bacterial, right? And of course, IV antibiotics, if it is a bacterial, and because it's the brain, of course, we're going to monitor your neurostatus. A multi. Cushing's patient have Cushing syndrome. What is that? What organ is that? What does it involve? Cushing syndrome. The adrenal gland has to do with cortisol. What's cortisol? Right? That's the way you think through this. So you actually have hyperglycemia, right? Any steroids, you worry about blood sugars. So excessive glucocorticoids, they have really thin arms, but there's big moon face, red, ruddy cheeks, and stocky in your trunk area. Typical patient with Cushing syndrome. They might have hair or acne. Those are some things you see with too much steroids. A 4-year-old child's admitted to the hospital. The nurse should ask the parents, which is a priority question. What do you really need to know? 4-year-old in the hospital, you're talking to the parents. What's important here? Well, we know 4-year-olds, this is your preschoolers, and they want mommy there, right? It's very important. Separation anxiety. You did a discussion question on it. You know, that is #1 question. The nurse is assessing a child who's just returned from surgery and a hip spica cast. Which outcome is priority? What are you looking for? They've had a hip spica probably due to that hip, that developmental dysplasia of the hip wasn't fixing from the Pavlik harness. So now they put on that cast. What do you worry about? What do you look for? So remember, it's ab with a B ducted, not adducted. We're going to make sure that any cast, right? Circulation, making sure their toes are wiggling and you have pulses there, right? Head of the bed elevated. On the left side, no, they're going to be flat, and let that cast dry in the meantime. A child diagnosed with new onset glomerulonephritis, which finding should the nurse most likely expect to know? What is glomerulonephritis?
A tea-colored urine.
Oh, absolutely. What is it caused by? Acute strep. So it's the kidneys, it's a strep infection. They're going to be no urine. They're going to be swollen, edematous, hypertension, and tea-colored urine. And it would be an elevated serum potassium. The nurse is monitoring a newborn of a mother with diabetes mellitus. The newborn is at risk for which complication? This one I didn't know. You know, we're all going to think it's hyperglycemia, but it's actually respiratory distress syndrome. Has something to do with surfactant and their sugar and the way things are produced. Remember, surfactant holds the lungs open so they don't collapse. So that's a respiratory distress syndrome. A multi. A child sustained a head injury from a fall. The nurse should perform which actions in the care of this child? You know, working in the ER like I did for the last 10 years of my career, I've seen children fall out of the second floor balconies. You know, little 2-year-olds climb up on something and head first. I've seen good outcomes and not good outcomes. But what we really need to watch out is, remember, any head injury, you worry about too much taking in because that will put swelling on the brain. So intake output, really important. You got to monitor those liquids. Head of the bed elevated. And then, of course, neuro assessments for sure. Encourage coughing, deep breathing is going to increase intracranial pressure. So no, no, no. A child fell off a swing and the child has broken the right leg. The nurse should take which priority action? What do you do when there's a broken anything?
Immobilize.
You need to immobilize it, and you also need to check neurovascular signs, right? So keep it straight, make sure blood is flowing, and of course, get proper care. Good job. A newborn is born with a subdural hematoma. The nurse should perform which action to check for major symptoms? Think about the brain and think about a hematoma, blood, occupying space, pressure on the brain. What might happen?
Blood.
So we got to make sure, are both sides still working like a stroke, right? We got to make sure that pressure isn't so big, it's creating damage, and then you would see it. Right side not moving, left side not moving. So making sure everything is still equal. Wrist restraints are applied after a cleft lip repair, which is a priority intervention regarding these restraints. You know, we're not encouraged to use restraints at all if possible because of the history of what has happened in the past. You know, I used to use vest restraints, wrist restraints, ankle restraints, and there was many incidences of there was lack of circulation and they had the amputation of something. So that's why today we don't want them. But usually cleft lip repair is the elbows, and that's so they don't touch it. But check hands, make sure all of those pulses are there. It's all about blood flow. A child just swallowed furniture polish. The nurse should instruct the mother to immediately perform which action? And this is a mainstay for any poison a kid might take or anything they might, ingest. Call poison control. Never, ever, ever give cat. Never, never, never induce vomiting, okay? So poison control, they'll tell you what to do. And I'm sure on the other line you're calling 911, but that's the way you do it. A 5.5-year-old client is 3 hours after a tonsillectomy. Which drink should be offered? And they can drink 3 hours after as long as they're awake and alert, right? Hey, I'm thirsty. Can I have something? What would be good? Well, I drink milk. It causes phlegm. I drink cherry Gatorade. It looks red like blood. I drink orange juice and it burns like heck, right? So diluted apple juice. And usually you start out with some ice chips to start with and then work into some liquids. Which type of precaution should the nurse implement for an infant with RSV, which is also called bronchiolitis? You see RSV, you see bronchiolitis, it's the same name, okay? Always remember that because exams do interchange those two words, okay? And it is both contact and droplet. It's not airborne, they call it droplet, which is, yes, you wear a mask. But remember, you always wear your gloves too, okay? That was a tricky one. I agree. The nurse is caring for a 6-year-old child with asthma. Which assessment finding requires immediate action by the nurse? Well, what do we know about asthma? The lungs go into bronchospasms, they tighten up. You can barely hear any air going out there, right? And it's all about getting the air out. You can get air in all you want, but it's like to get it out. If it gets to the point there's no press downs, that means your lungs are completely tight. Now you have a problem with ventilating this child, okay? My husband went into status asthmaticus about 3 years ago. And all I heard at the end of one breath was that's it. And that's all he was breathing. He was the intensive care unit for 12 days. So I understand asthma quite well. I lived it. A child is admitted to the hospital to rule out cystic fibrosis. Which finding of sweat chloride is indicative of cystic fibrosis? So I put this one down here. Is it small, medium, or large? Right? Because it's all about looking for the sodium on the skin. Small, medium, or large amount. Remember I told you, if you licked a child with cystic fibrosis, never do it, it would be horribly salty. It is the most. It is like salt, salt, salt. That's why you'll never restrict salt on a child with cystic fibrosis because they lose it. Okay. That's the point of that question. Teaching an adolescent with cystic fibrosis about pancreatic enzymes, which indicates a need for further teaching. So remember, without these enzymes, they're not digesting food and they're losing nutrients. So we know that you have to swallow them whole or take them, open them up, put them on food and eat it. And the powder, make sure we rinse them out. If we use that, we are always gonna, make the dose bigger as they grow, but it should be immediately before they eat, not 2 hours. And they will tell them to give more with meals and less with snacks. It might be 2 with meals, 1 with snacks. And that's up to the physician also. The nurse is assisting a school-age child with cystic fibrosis to make dietary meal choices. The nurse suggests what? What do we know about cystic fibrosis? What do we know about the pancreas and pancreatase? What do we know about even what the stools look like? They're these really foamy, bulky, nasty type of stools also. These children need food. They need, and you know something, the answer is the yellow one. High protein, high calorie. Fat goes through them. And because they don't digest it, I'm gonna have to change that answer. I'm glad I looked at this with you. Mark that down. Also, remember, if you're taking the fat by mouth, eating it, you're going to bloat and have abdominal cramping and pain and discomfort because you're not digesting it. So high protein for muscles and healing, high calories so they are not losing weight. So that is the answer. I apologize. Which procedure should the nurse use when instilling prescribed eye drops and ointment to a child? Remember when you put ointment in any person's eyes to tell them it's going to make it all foggy and blurry? Because especially a child will be like, I can't see, right? That's why we usually only do them at night. So remember, the PINA is all about ears. We're talking about eyes here, okay? You never put it directly on. You don't put them down and the head up. You just put the drops in, okay? Let it go through 3 minutes and then put the ointment when it's done, okay? And that's the proper thing here. A multi. The nurse should take which actions when caring for a child experiencing a seizure? So what do we worry about a child with a seizure? I mean, what can you do for that child? You can't open their airway. You can't stick things in their mouth. So what we need to do is turn them on their side, right? They're going to vomit. And then all of the other stuff here. Children can have seizures anywhere. They could be out of bed, they could be in bed, they can be in the shower. So get them on the floor if they're up anywhere and have the area around them nice and clean so they don't bang themselves and hurt themselves on anything sharp, right? And put them on their side. Why again? So that if they vomit, it'll come out. And always, if we have suction at bedside, be good. But don't jam anything in their mouth while they're seizing. You'll only break teeth. We don't want to do that. A child complains of a fever, particular rash, nausea, vomiting, headache, and nuchal rigidity. Your nurse's priority reaction. I mean, with all those things, if you don't know what it is, nuchal rigidity, what is that? And what diagnosis do you see that with? So this child is probably a meningitis, right? You've got this rigidity going on. And they have all of these things as part of their diagnosis. Vomiting, headache, it's the brain. And that nuchal rigidity, that's keying you right in there. So, yes, you're going to give Tylenol eventually, but you need to protect you and everybody else first from the child so that we don't spread this around the hospital and to yourself. An adolescent arrives in the ER with complaints of persistent epistaxis. What do they need to do? What is epistaxis? Again, I would look at definitions, okay? Very important thing. If you know definitions, many times you can make the answer. Yes, epistaxis is nosebleeds. So number one, have them calm down and sit down, right? If they're up and running around and going crazy, their heart rate's up, blood's going to keep flowing, right? So have them sit down, lean forward so the blood comes out, because if we put them back, they're just going to gag and swallow it. And we just don't want that to be done, right? So you take your thumb and your finger and press it, lean it forward. They say, Do that for 10 minutes. When you release it, if it's still bleeding, go seek medical attention. They might need to cauterize it. And there's actually something called nose tampons, which basically are tampons that expand and put pressure on the little capillaries and stop it. And sometimes they need to go to the OR. Care for a 2-year-old child admitted to the hospital in heart failure. Well, what is heart failure? The heart failed, right? But what does that mean? What do you see? Well, the heart's not beating good. It's weak. Blood is black flowing up into the lungs, filling it up with fluid. Oxygen's not getting everywhere it needs to go. So this child's going to be very weak, going to be tired, but you still got to feed them. You still got to do your assessments, etc. So you're going to do what we call clustered care or organized care activities. So cluster care, so they get that rest, okay? Are we going to be counting diapers? Well, of course, I know daily weights too. Making sure that when we get them on the medications that they are urinating and getting rid of it, okay? So organized care rates, organized care periods, and then intake output and daily weights. Teaching parents about tetralogy of Fallot interventions for hypercyanotic episodes. How do you know she don't understand it? And you have to teach her some more. Something here is not right. Tetralogy of Fallot, right-sided heart defect, where all of a sudden the pulmonary artery closes up and blood can't get to the lungs. You're not getting oxygen to the body, right? So it is a dangerous thing. We do knee chest, right? That'll open them up. But, you know, tetralogy of Fallot, you do not need to limit their activities. They need to do what they're able to do, they're capable of. When they're tired, children are great. When they're tired, they'll sleep. Adults will go forever, but not children, okay? The knee chest is when they're in that spell and it will pull them out. You put them on the front and hold them up. If they're laying down, knee chest in the crib, that will help too. And okay, the rest is there. Which assessment findings should the nurse expect to be documented before repair of the coarctation of aorta? And then I'll ask you, how do you diagnose? What's one of the things that you diagnose a coarctation of the aorta? Where are the differences here? What happens? And this is what I call a kink in a hose, right? This is the aorta coming off the heart, and got a kink, and it's narrowed, and blood can't get down, so it stays up. So your upper extremities have more blood flow, higher blood pressures. It has less flow to the lower blood pressures. And that actually is the first part of diagnosing coarctation of the aorta. You feel pulses in the lower extremity, you don't feel, or they're very low. Next step, I'm taking 4 extremities. I actually diagnosed one of them in my career. It's pretty cool. Which assessment findings should the nurse expect to note in a child with hypovolemic shock? What do you see with hypovolemic shock? What does hypovolemic mean? That's lack of volume. That means there's not a lot of blood flowing due to bleeding or dehydration or whatever. So what are you going to see? Decreased blood pressure, elevated heart rate, prolonged capillary refill, decrease in urine output because there's no blood flow going on, okay? Those are things. They get pale, and they can even get a little bit confused because they're not getting oxygen to the brain too. All of these things are about shock, whether you're talking hypovolemic or any shock. Elevated heart rate, decreased blood pressure, prolonged capillary refill, decreased urine output, pale color, you know, and all those things have to do with dehydration, tenting of the skin, et cetera, et cetera. So that is the shock. A multi. Which intervention should the nurse plan to implement for a child with Kawasaki disease. And Kawasaki is not a motorcycle here. So Kawasaki disease is a viral disease where it causes a systemic vascularitis or inflammation of blood vessels. The most one that we're concerned about is the coronary arteries, okay? And the coronary arteries can have a balloon and rupture and of course cause death at that time. How do we treat this? Well, we give aspirin to have the blood flow because there's little embolus blood clots because of this. So aspirin, and then their eyes turn bright red and they're very sensitive. So be careful with the lights. And then the other part of the treatment is IVIG. You will see strawberry tongue and cracked lips, peeling hands and feet. These are all part of Kawasaki. And our biggest concern are those coronary arteries. A multi. Child with tinea corpus, ringworm, who is on the school wrestling team should include which measures? What should he do? Tinea corpus, ringworm. It's a fungus, right? You know, we think of ringworm, we think of the little things, earthworms in the ground, right? This is not that. It shows up as round rashes, but it is a fungus and it itches. Now, if you're on a wrestling team, you've got to be concerned about the other people because you are in contact, you're touching, right? So you really need to make sure your skin, see if it's spreading. You need to wash with soap and water after practices so it doesn't spread, okay? That is a big, big thing. Antibiotic ointment, no, they're going to have some sort of, you know, antifungal. You can have contact because these are not lesions that ooze. These are more of a rash, okay? And the grivulsin is the one that goes on the head, and you take it for a period of time. You never stop any medications if, you know, you're feeling better because you don't get it all away. So which teaching point is a priority for parents of a toddler with leukemia? You know, one of the things about being a nurse, most of our job is teaching. You know, and if we teach, that means we have to understand what we're teaching about, you know, and that's the hard part. But after a while, it becomes one as you keep teaching. One of the things about leukemia, you don't have any sort of immune system. You have immature white cells that don't work. So washing hands is number one, no matter what. The nurse should include which measures in the plan of care for an infant after a cleft lip and palate repair. You have an infant. What are we worried about? Well, we're going to use those elbow restraints, right? So that we're not going to be pulling at it. And that's what we want to worry about, okay? Now, some of these infants want a pacifier. You know, that's something that the physician has to tell you whether or not you're going to do. But the one thing we don't want them picking at it because they take the lip and they have to approximate these edges so that they don't have a crooked lip when they grow up. And that's important, especially if you're a girl. A multi. The nurse is caring for a toddler diagnosed with intussusception. What do you need to do for that? You know, intussusception is the intestines. They telescope into each other. And you see the symptoms of sudden onset of really intense abdominal pain. These kids has a rigid abdomen and they're usually their legs are really kicking. So number one, you got to diagnose it, right? So you do an ultrasound. Now, if the pain stops, it came out by itself. That happens quite a bit. Now, if it's in there and we get that on ultrasound, they're still in pain, they'll go over to radiology. And the radiologist will perform either an air or a contrast enema. And that pushes out that area that's on top of each other. Sometimes, usually it's pretty rare actually, they might have to do surgery, but that's really rare. And why IV fluids? Well, we want to have them nice and moist, right? Just dehydrate, it's going to attach to each other better. So you want to moist it up so it comes out easier. A child in the ER with a diagnosis of early chickenpox, varicella, important for the nurse to have ready at the bedside. What is our concerns about varicella, chickenpox? There's a vaccine today. We get 2 of them. Was it 15 months and 4 years old? So varicella is airborne. So mask. I-95, that N9, I-95 is the highway down the street here. N95 mask, and that will really cover the mouth and prevent me from getting it too. Because even if you have the vaccine, I have seen many a child get it, even with the vaccine. So always protection. And of course, always hand washing, always. What type of preventable injury is associated with developmental stage of crawling infant? What are we worried about? An infant who now is crawling around on the floor. They're what, 8 months old now, crawling? Curious. They've got good, fine, and gross motor skills at this point. We're about everything in the mouth, right? How do they explore the world? In their mouth, everything in the mouth. And yes, choking is our biggest concern. A multi. A child diagnosed with bacterial conjunctivitis or pink eye. What are the clinical manifestations of that? What do you see? We just had one of our instructors, actually a maternity instructor, had such bad pink eye she couldn't open her eyes. And you see this oozy, gooey, crusty, colored exudate all over. The conjunctiva or the thin lining is all inflamed. The lids are swollen. They don't itch, they hurt. And how do we treat conjunctivitis? Well, it's bacterial. They'll get a bacterial ointment. This is the one that you'll do the ointment at nighttime, making sure that we clean from the middle out on these eyes and never share the washcloth between both sides, right? And then just between you and me, what I tell parents, make sure you change the pillowcase every night or wherever they're sitting every day, because all you do is recontaminate the child, right? Something that it's not taught. I'm just telling you, I teach that as a nurse. Diabetes classic symptoms include, what is the symptoms?
They wouldn't let me select all.
It's not polychronia. I don't even know what that is. It's a great word. It's pretty. It's the triad: polyuria, polydipsia, polyphagia. Be careful. Diabetes insipidus is only 2, hungry and thirsty. Remember, that's all about fluid, not about sugars. Diabetes mellitus is all about I'm hungry, I'm thirsty, and I'm urinating. Be careful with those. That's common mistakes. Your patient complains of extreme muscle weakness. The physician orders an EMG. What's an EMG? Years ago, I had a problem with my neck and was admitted in the hospital, and they did an EMG on me. And these little tabs are put on the arms and legs, or sometimes little needles, and they take a little bit of electricity and they put it to the tab, and they watch the muscles spasm. The problem with this electromyogram, that's myo, muscle, you're measuring muscles, muscle weakness, Duchenne, muscular dystrophy, muscle weakness, they measure it. Now, when they're doing all of these little stimulations, it's like you have gone to the gym and worked out. These children do hurt when they're done. So I would warn the parent and not tell the child, because now they're going to be concerned about hurting, but let the parent know it's temporary, and get them some Tylenol when they come back, because they're going to need it. It hurts. Multi. Infant nutrition includes I thought this was a great question because it's a little different than what you would think. We know the first 6 months it's only formula, iron fortified, or mom's milk. And then we introduce, the foods one at a time, 4 to 7 days in between. But no honey. Remember botulism, it can cause. And then no cow's milk. We do that at 1 year. And remember, it is whole milk that we give. They need the fat for their central nervous system. A multi. What nutrients tend to be lacking in a toddler's diet? Well, these are the finicky eaters, right? They go through this, what we call a physiologic anorexia, which means they only eat little things, and parents get so concerned. But this is normal. They're not growing that much as toddlers, not like infants. But all of it, everything, it's the total overall, they're missing stuff. So if it is a problem, then the physician might order a multivitamin, but it's a normal thing for your toddler to be picky, small eaters. Very normal. Autism is expected in a toddler. He exhibits all of the following symptoms except he's not going to reach any milestones in the language. Many of them don't even speak a word, up till 2 years, and sometimes even more. We know they're repetitive, absolutely. They don't like touch. They don't like sound, noise, lights, crowds, people. This is just all part of a child with autism. Now, this can be corrected somewhat, those behaviors, if they're like in a program where they're on a routine every day, the same thing, and they know what's coming and they can be taught. And I've seen it. This one child that when I was working the clinicals and teaching them for, the local Fortis, and this little boy was a Downs autistic child. And this boy knew what to do, came in, put his backpack in the cubby, sat down, waited for vital signs. He knew what was expected because he had early intervention. Which of the following is a sign of measles? Well, we don't need to know that, right? Because we have a vaccine again. Remember, not everybody gets vaccinated. And remember, German measles is very dangerous for a pregnant woman, okay? So rash and fever, it's not upper respiratory and has nothing to do with hair. That was actually a pretty good guess, guys. If you get a vaccine for measles, you are what? And that's actually a picture of the type of rash you see. So either you get a vaccine or have the disease, you have active immunity. Okay, that means your body's produced the antigens that are going to fight so that you hopefully you're not going to get it or you have less chance of getting it. Hydrocephalus, what's that? It's just fluid in the brain. How do we treat it? Usually a ventricular peritoneal shunt, and that will help drain it. Many times you're going to see hydrocephalus when you see a child with those meningococcal or a spina bifida, where the meninges and spinal cord aren't inside the body at birth. And then the spinal column can't handle fluid. So they're going to have a ventricular peritoneal shunt because they're apt to get the hydrocephalus. What causes hydrocephalus? Well, I told you meningococcal or spina bifida, but what is the reason why they are?
Cerebral spinal fluid.
It's all about cerebrospinal fluid. You know, you've got a brain and you've got your spinal column, which is, covered in cerebrospinal fluid, right? Sometimes it can't move the way it should because your body's producing it. Just like blood flows around your body, there's an obstruction, something's going on. So what happens if we have too much fluid in the brain? Now you have pressure in the brain, and then a whole list of things could happen from that. And last question, typical treatment for hydrocephalus. Now, with this question here, what do you think, what medication would you use for a child that has cerebral edema, too much fluid on the brain?
Meningococcal.
Absolutely. Very good, guys. And yes, it's a ventricular peritoneal shunt. That's exactly. If they have hydrocephalus, we're not just going to be given diuretics. It's not the way. We need a constant because we don't want pressure. Because once you have pressure in the brain, it's like putting a finger on a Band-Aid on a boo-boo that doesn't bleed anymore. Guess what? There's no blood going to an area. You could lose memory. You could use your ability to walk or talk or see. And so we don't do that. It always goes to the VP shunt. And if it's not working, you'll see vomiting and headaches. Garshell, number 3 today. Number 2, AMG. Good job, Amy, with your 98. And Whitney, look at you, who's worried about the exam. Number 4, Kimmy and MM. You know, guys, you did really well for coming in and figuring this out. There was some really tricky questions there. So that was very good. Now, as I said, tomorrow you'll be getting your grades. I will be sending you out all of your HESI information. If anybody wants to meet with me before I leave on early Wednesday morning. I do teach a class late on Tuesday night. So Monday, Tuesday, if you need anything, just send me a message. When I go on vacation, I don't know how much internet I'll have, and I really want to try to turn it off for the first time in 5 years. I've not really had that vacation, so I'm going to try. You do have Dr. Stiles as a backup, and always Dr. Brown is here for you if you have like problems with your HESI or anything like that, okay? I wish you all the best. I'm not going to see you again. It's been a pleasure. I've enjoyed teaching you, and I hope you learned something this semester. I appreciate if you, when you turn in those evaluations, anything I can do to make this better, I want you to let me know, because I change and do things every semester, every quarter to help you succeed.